It is easy to dismiss marijuana as a harmful drug rather than a legitimate medicine that could prove to be helpful. I am here today to inform you that after weeks of research, we have come to the logical conclusion that medical marijuana is, in fact, a helpful and effective medicine. However, with that said, we understand the controversy of this heated topic and value others' perspectives. First of all, let's start with some background. How typical marijuana affects the body systems. THC-like compounds made by the body increase the permeability of the intestines, allowing bacteria in. The plant-derived cannabinoids in marijuana block these body cannabinoids, preventing the permeability and making the intestinal cells bond tighter together. Marijuana also affects various body systems. The endocrine system, for example, produces body hormones, the internal chemicals that control how and when we develop. Marijuana triggers a short-term drop in the hormones that direct growth and development, lowers sperm production in males, resulting in fewer normal sperm cells, and also affects the balance of hormones that control the menstrual cycles of girls and women. In adults, these changes are temporary, but researchers suspect that young people risk possible long-range developmental problems. As a precaution, they warn kids to avoid pot and reduce the risk. Marijuana also affects the brain. Pot tilts the balance of chemicals in the brain that regulate mood, energy, appetite, and attention. It affects learning and memory processes and can cause forgetfulness and reduced concentration. Pot also reduces logical thinking and calculation skills and can impair a user's ability to perform complex tasks, including driving a car. However, the depth and detail of how pot truly affects the brain scientifically is unknown.
However, today we will be zeroing in on a different healing aspect of pot, medical forms of cannabis. Today there are so many who are suffering and sick. If medical marijuana has the potential to help people, awareness about the medicine must be spread. Studies show that this drug may solve a number of diseases such as asthma,
epilepsy,
and other illnesses. Scientists have confirmed that the cannabis plant contains active ingredients with therapeutic potential for relieving pain, controlling nausea, stimulating appetite, and decreasing ocular pressure.
Marijuana also may be able to slow the progression of Alzheimer's disease by a study led by Kim Janda of the Scripps Research Institute. In 2006 study published in the journal Molecular Pharmaceuticals found that THC, the active chemical in marijuana, shows the formation of amyloid plaques by blocking the enzyme in the brain that makes them. These plaques are what kill brain cells and cause Alzheimer's. Robert J. DiLorenzo of Virginia Commonwealth University gave marijuana extract, a synthetic marijuana, to epileptic rats. The drugs rid the rats of seizures for about 10 hours. Inflammatory bowel disease like Crohn's disease could benefit from marijuana use, studies suggest. University of Nottingham researchers found in 2010 that chemicals in marijuana, including THC and cannabidiol, interacts with cells in the body that play an important role in the gut function and immune response.
In the gut function? You just did that. Keep going.
The study was published in the Journal of Pharmacology and Experimental Therapeutics. CBD is a cannabidiol, which is a compound in cannabis that has medical effects but does not make people feel stoned. Cannabidiol is one of the major compounds that has healing properties to those suffering. CBD accounts for up to 40% of the plant's extract as a non-psychotropic cannabinoid. Other things CBD can be helpful for is PTSD, migraines, depression, arthritis, cancer, heart disease. More studies show that this little-known compound may have the capacity to help stop the progression of Parkinson's disease, Alzheimer's, and diabetes. We need to make this fact more known. Charlotte Figi. Charlotte's life depends on this plant. This 6-year-old girl suffers from debilitating seizures as a result of a rare form of epilepsy, a condition that has driven the family through just about every possible treatment, searching for some form of normalcy in their lives. She experiences a seizure 1 every 25 minutes, and these seizures usually last for about 10 to 15 minutes. When she was 5 years old, her seizures reached the worst they've ever been. Doctors took the parents home and told them to prepare themselves. They signed a do not resuscitate and took Charlotte home. A dispensary that Charlotte's mom contacted because they couldn't find any other option has actually been working on developing a non-psychotropic strain of marijuana, which has drastically reduced seizures for many pediatric epilepsy patients in Colorado. This means that this form of cannabis does not get you high like typical marijuana. After using these strains, her seizures went down to about 1 or 2 seizures a week. This is phenomenal. And she was off all medication pills. All in all, her daughter's seizures fell from 300 a week to around 3 over an 8-month period after just trying cannabis oil. This is a quote from her mother. Charlotte is consistently eating and drinking on her own for the first time in years. She sleeps soundly through the night. Her severe autism-like behaviors of self-injury, stimming, crying, violence, no eye contact, zero sleep, lack of social contact are only things of the past now. She is clear-headed, focused, and has no attention deficit. Charlotte rides horses, she skis, she paints, dances, and hikes. She even has friends for the first time. Her brain is healing, she is healthy, and she is happy. However, what is sad is that Charlotte cannot even go out of her state. Her family can't even go on vacation. They can't go on vacation without being classified as drug traffickers while bringing her medication so that she doesn't die. Something needs to change.
Jaden David. Jaden's doctors prescribed 22 anti-seizure pills a day, which controlled the seizures but left him immobilized due to the side effects. 60-year-old Jaden David has Dravet syndrome, a rare and catastrophic form of childhood epilepsy. It has triggered seizures so frequent that 44 times he has been rushed to the hospital in an ambulance, his distraught father by his side. Not anymore though, says his father, thanks to medical marijuana. Before he started taking a liquid, non-psychoactive form of marijuana, Jaden couldn't walk, eat solid food, or take a bath.
Instead of medical marijuana, this is miracle marijuana, said David's dad. Don't really understand. The problem is growers realized decades ago that THC is what sells. It provides a floating, euphoric feeling people associate with marijuana. In order to enhance THC content, CBD has been bred out of many strains, leaving users with highly psychoactive experience but not necessarily the healthiest experience. Well, especially for those with pre-existing mental disorders. CBD also turns off the cancer gene found in metastasis. Scientists at California Pacific Medical Center found that CBD turns off a gene that causes cancer cells to metastasize or spread. This added to the scientific knowledge that marijuana is one of the most beneficial medicine that a cancer patient can use, whether it's for stopping cancer cell spread or just for the physical relief. Cannabidiol stops cancer by turning off a gene called ID1.
A clinical trial in Germany found CBD to be as effective in treating schizophrenia as common as
psychotic
medication with far fewer side effects. Here's a different aspect. Marijuana is classified as a Schedule I substance, defined as the most dangerous drugs, with no currently accepted medical use, but also a high likeliness for abuse. Neither of those statements has ever been factual. Even many of the most passionate critics of medical cannabis don't agree with the Schedule I classification, knowing how it's prevented the ability to conduct research.
Even the head of the National Institute on Drug Abuse, Dr. Nora Valko, seems to have softened her stance. She told Dr. Sanjay Gupta that she believes we need to loosen restrictions for researchers. Pete Carroll, the coach of the Super Bowl winning Seattle Seahawks, said the National Football League should explore medical marijuana if it helps players. NFL Commissioner Roger Goodell hasn't dismissed this idea, saying that if marijuana is reconsidered by the medical establishment, the league would treat it the same as any other medicine. Goodell also says the NFL is following the science that suggests marijuana may help recovery from people suffering from concussions.
The U.S. government is in a way schizophrenic about the way they view medical marijuana. They state that it has no medical value. However, have been funding research on the drug for many years. The American Medical Association and the American College of
Physicians
have taken position that medical marijuana be taken off Schedule I classification so that the research on the cannabinoids can be easier. We must effect social change and map a path toward helping those who desperately need revolutionary medicine.
to you by the Legalize It campaign. Legalize the weed.